All right, so we'll take a little bit of a look kind of at these basic movements and kind of a muscle attachment. So we know that muscles um, attach to bones, but they have a couple different kind of attachment sites. So that's where a movement actually comes from. Movement happens essentially when that muscle moves an attached bone. So you can see the example over here to the side. This is a basic kind of bicep curl. This muscle here would be what's referred to as the brachioradialis, all right, because it's attaching to the humerus and then attaching out to the radius in the forearm. So it's going to give you that kind of basic, almost what we call like a hammer curl, all right? So moving that kind of with your thumb pointed upwards. Those muscles, they have two basic attachment points. Some of them have more, but they have at least two attachment points, okay? The first one's what's referred to as the origin. All right, so this is its attachment to kind of the immovable bone, or a lot of times referred to as the anchor. So like in a bicep curl, you're trying to keep the upper portion of your arm stable while you're doing that curl. So really the movement is at the elbow, not at the shoulder. But our bicep, because of the way it attach, can cause some shoulder movement as well. So we kind of have to remember that. The bone normally that it attaches to can move. It just in those cases, whatever the main movement that that muscle is trying to create, it's not supposed to. The insertion point then is the portion that's going to move. All right. So again, in this case, the origin is the humerus for this example. And then the insertion point is on the radius. Okay. Most likely when you guys take anatomy, if you take anatomy in college, this to me, I think is one of the hardest portions to remember, because depending on the instructor you get and depending on how technical they get, the insertions, the origin and insertion is really hard to kind of remember, because sometimes the origin's like the outer 2/3 of the humerus, the distal third of the radius, and things like that. So you kind of have to remember those. And I remember kind of going through most of my schooling. This is probably one of the hardest ones. The only way to really remember them is flashcards, but fortunately for this, we don't really have to remember all those. Okay, so we'll just kind of go over a little bit of this. Oh, somebody just joined us. All right, so that's the origin and insertion. So we have some basic movements that we get kind of from some of those muscles. So we'll try to go over a little bit of these. I know specifically on the assessment, there is going to be a couple of these, so make sure you just kind of have them down. So the first one here is flexion. So flexion decreases is going to decrease the angle of the joint. All right, so that elbow flexion that we just talked about, that's decreasing the angle of the joint. Knee flexion would be like a hamstring curl. Hip flexion would be bringing your hip up closer to your upper body. Trunk flexion would be kind of leaning over to like touch your toes. All right, but that's decreasing the angle of the joint. Extension is going to increase the angle. Okay. So when we look at kind of those going back and forth, they're just kind of opposites of each other there. Okay. All right. Rotation. Rotation would be movement from side to side. All right. So you could get trunk rotation. All right. That would be just trunk rotation. We're getting most of that movement out of the lumbar spine. You could also do cervical rotation. That would be moving the head from side to side. All right. Kind of in a no, like if a person were to shake their head in a no direction. All right. That would be kind of rotation. Abduction is moving something away from the midline. All right, so if you were to abduct your shoulder, that would be moving your shoulder out to the side away from you. That would be your deltoid doing that for you. So if your deltoid contracts, it does abduction. You've got hip abductors, so if you move your hips out. So if you were to do like jumping jacks, the first movement when you move your arms up and out and your legs out, that would be abduction. Adduction is moving things back towards the midline. All right, so abduction would be moving things back. The way that I kind of remember these is adduction starts with ADD, so adding. So you're adding things back to the body. All right, that's the way that I kind of remember the difference between the two. So if it starts with ADD, we know that that's going back towards the midline. ABD goes away from the midline. Okay, circumduction is most often done at our hips and shoulders. All right, so you can circumduct, you can move in a circle. All right, so circumduction is kind of movement in a circular pattern. So you can circumduct your shoulder. All right, that's not a basic kind of rotation movement. That's referred to as circumduction. The hip would be circumduction. All right, but those would be your basic ones there. Be okay with those? All right. This just shows a little bit of some of the other ones. So this is a pretty good example I would take a look at. So you can see your flexion up here at the top, right? So you can see this is shoulder flexion, moving it. We're increasing the angle at the shoulder. That's knee flexion they're showing again in that one. Extension, they're showing bringing the knee back down out of flexion back to anatomical position. There's also those that are referred to as hyperextension. So hyperextension is past kind of anatomical position. So you could do hyperextension of the shoulder. You could do hyperextension of the hip. All right. But those are a couple of the ones. You can see the difference between rotation. Okay. And those, there's a couple other ones. Here's the circumduction that I was talking about, ab and adduction. All right. But those are a couple I would make sure you take a look at. A few of the special movements that we take a look at. Dorsiflexion, this happens in the foot. So dorsiflexion is pulling your toes up towards your shin. That would be the movement that you would do if you wanted to walk on your heels. All right, that would be dorsiflexion. All right. Plantar flexion would be like if you were to walk on your tiptoes. All right, so that's like pressing on the gas pedal of a car. That's plantar flexion. All right, inversion is turning the sole of the foot inward. Right? Most people, when they sprain their ankle, they do an inversion ankle sprain. So they step on somebody's foot and they roll their ankle. So the sole of their foot goes to the inside. Eversion would be the opposite. All right. Most people who have flat feet are everters because they walk on the medial part of their feet. Okay. Supination is turning the palm up. Right. The way that I always remember this one is you turn your palm up, you can hold a soup bowl. All right. That's supination. And then pronation is palm down. Okay. Opposition is essentially taking your thumb and touching your pinky. That's opposition. All right, but those are a couple of the movements. I would make sure I know a few of those because you will see a couple of those on the assessment. Again, I'll try to make sure I include them in the review document when we get to those. Okay. I don't think those will be too tough. Everybody right with those? Okay. All right. Other types of movements that we have. So these are the basic ones that we have here. So we've got what's referred to as a prime mover. All right. Prime mover is the muscle that's the major responsibility for a certain movement. All right. So like with knee flexion, your hamstring muscle group is your prime mover for knee flexion. Elbow flexion, your bicep brachii is the one that's the prime mover for that. We do have some other ones that are referred to as antagonists. So they oppose or reverse the movement that a prime mover does. So your bicep brachii is the prime mover for elbow flexion. The tricep then is the antagonist, which does elbow extension. All right. Hamstrings do knee flexion, quadriceps do knee extension. Synergist muscles are the ones that aid the prime mover, so they help with that. So again, bicep brachii is the main one for elbow flexion, but we also have a brachioradialis. We have a bicep femoris, or sorry, not a bicep femoris, that's in the leg. But we have some other muscles in the shoulder that will do that as well. We also have some fixators. Those are ones that stabilize a lot of that movement. All right, so a lot of the muscles of your back are fixators. All right, they're necessary to be able to do all this motion we have at the shoulder, and without it, we can then end up with some unintended movements that we don't want that usually can lead to injuries. Okay, this PowerPoint is the one, or sorry, the crash course is probably the one that you guys saw the other day. I'll post this video as well, though. Naming a muscle tissue is there's a couple different ways that we do this. So the first one is what's referred to as the direction of the fibers. All right, so in this example we have here, this is what's called rectus. These are straight muscles. So you can see the fibers run straight up and down here. That's the rectus abdominis. All right. We can do it by size. All right. We have maximus and minimus. All right. So maximus is large, minimus is small. So you have a glute max. This is the glute minimus here. Location is another one that we sometimes use for naming. All right. So a lot of times with location, we're actually using the name of the bone that it attaches to. Okay. So you can see this one here is the frontalis. All right. It sits over the top of the frontal bone. This one here is the temporalis. It sits over the top of the temporal bone. We have some other ones a lot of times that are named specifically by the bones that they touch. So there's a muscle here in your neck called your sternocleidomastoid. All right. It attaches to your sternum, it attaches to the clavicle, and then it goes all the way up and attaches to the mastoid process in your skull. All right. But that's how it gets its name, is because of those three bones that it attaches to. Okay. Another way that we can name things is by origin. All right. So like the triceps has 3 heads to it. The bicep has 2 heads to it. All right. So you can see we've got a couple different ways that we can kind of name muscles. Other ways that we can name them, location here. I think I'm off on my numbers. Yep, that should have been 5. Okay. So location as well as origin. So there's your sternocleidomastoid that I was talking about. Again, it's here at the sternum, goes over to the clavicle, goes all the way up to the mastoid process. All right, we can do shape. All right, best one here is the deltoid. It's kind of a triangular shaped muscle that we have here in the arm. All right, and then the last one that we usually kind of talk a little bit about is action. All right, so flexors flex, extensors extend. All right, so in your forearm, all the muscles that are on the palm side of your hand are flexors because they flex your wrist or fingers. All the muscles on the back side of your forearm are extensors. They do extension on that side. Right? And I think that's where we're finishing. So, all right, anybody have questions on those? All right, I know I just looked at the assessment this morning, so I know there's a few questions on a couple of these, like how do we name them? What's the way to name them? And then specifically the movements. I would make sure to take a look at those again. Okay. Go ahead and stop.